Have you ever wondered why the air feels heavier and visibility reduces during certain times of the year? Why do health concerns spike during winter in cities like Delhi? The culprit behind these phenomena is smog, a harmful blend of smoke and fog that has severe implications for our health and the environment. Smog, especially prevalent during October and November in regions like North India, poses a grave threat to urban and rural communities alike. Let's dive deep into understanding smog, its causes, its devastating effects, and how we can work to reduce its impact. What exactly is smog? Smog is a form of air pollution caused by a mix of pollutants like nitrogen oxides, volatile organic compounds, VOCs, sulfur oxides, and particulate matter. These pollutants, emitted from vehicles, factories, and other human activities, combine with natural fog or sunlight to create a dense, cloudy haze. While it may look like a harmless fog, smog is far from benign. It reduces visibility and carries harmful pollutants that can penetrate deep into our respiratory systems. There are two primary types of smog. London-type smog occurs in colder temperatures and is a result of burning coal, fly ash, and sulfur compounds. This smog is dense and has a significant impact on respiratory health. Photochemical smog forms in urban areas with higher temperatures and automobile emissions. It occurs when sunlight reacts with nitrogen dioxide and hydrocarbons, creating a brownish haze that irritates the eyes and throat. Causes of smog: human and natural factors. One of the primary causes of smog is vehicular emissions. The millions of vehicles on the roads release hydrocarbons, nitrogen oxides, and carbon monoxide, which contribute significantly to urban air pollution. Industrial processes and power plants also emit sulfur oxides and particulate matter, worsening smog formation. Additionally, agricultural practices such as stubble burning release harmful gases like carbon dioxide and black carbon, which further exacerbate air pollution. Combined with human activities, these natural elements make smog an ever-present threat in many regions. Health hazards of smog exposure. The health effects of smog are far-reaching and can affect people of all ages, especially children, the elderly, and those with pre-existing conditions. Smog is a leading cause of respiratory issues such as bronchitis, asthma, and chronic obstructive pulmonary disease, COPD. Inhalation of particulate matter irritates the airways, causing wheezing, coughing, and shortness of breath. Prolonged exposure to smog can lead to severe cardiovascular issues, including heart attacks and strokes. It can also impair cognitive function, contributing to mental health disorders like anxiety and depression. The World Health Organization has classified particulate matter and smog as a Group 1 carcinogen, linking it directly to lung cancer. Environmental impact: soil, water, and ecosystem. Smog doesn't just harm humans, it wreaks havoc on the environment. Excess nitrogen from smog settles on the land, disrupting soil fertility and affecting plant growth. Ground-level ozone, a key component of photochemical smog, damages crops such as wheat, soybeans, and cotton, leading to reduced agricultural yields. In water bodies, smog contributes to acid rain, which alters the pH balance and harms aquatic ecosystems. Lakes and streams become acidic, disrupting the nutrient balance and threatening aquatic life. Over time, these environmental effects cascade, damaging ecosystems and reducing biodiversity. Impact on animals and wildlife: smog poses a serious threat to wildlife, especially animals that rely on clean air and water for survival. Small mammals and birds are particularly vulnerable, as the fine particulate matter in smog can enter their respiratory systems and cause health issues similar to those experienced by humans. Additionally, smog reduces the availability of ultraviolet UV light, which many animals depend on for natural processes like vitamin D synthesis. This disruption can lead to weakened immune systems and reproductive issues in some species. The long-term effects of smog on animal populations could lead to declines in biodiversity. Road safety and visibility challenges. Smog dramatically reduces visibility, increasing the risk of road accidents. Drivers often find it difficult to see vehicles or pedestrians, especially during early mornings and late evenings when smog levels are higher. Airplane landings and takeoffs are also severely affected, posing risks to air travel. Poor visibility caused by smog extends beyond transportation. It disrupts daily activities and can impact emergency response times during disasters. These visibility challenges underscore the need for immediate action to control smog levels. Smog and climate change, a vicious cycle. Smog contributes to climate change by releasing greenhouse gases like carbon dioxide and methane into the atmosphere. These gases trap heat, leading to global warming. Conversely, climate change exacerbates smog formation by creating stagnant weather patterns that trap pollutants close to the ground. This vicious cycle has far-reaching consequences. Warmer temperatures accelerate the chemical reactions that create photochemical smog, worsening air quality in urban areas. Steps to reduce smog in cities. Reducing smog requires collective efforts. Governments must enforce stricter regulations on vehicle emissions and industrial processes. Encouraging the use of electric vehicles and investing in renewable energy sources are vital steps. Individuals can contribute by using public transportation, carpooling, and reducing reliance on personal vehicles. Regular vehicle maintenance, such as changing engine oil and servicing, also helps minimize emissions. Public awareness campaigns are crucial to educate people about their role in combating smog. Tackling agricultural practices. A key solution. Agriculture plays a significant role in smog formation, particularly through stubble burning. Farmers often burn leftover crop residue to clear fields, releasing harmful pollutants into the air. Governments must provide sustainable alternatives, such as biodecomposers and equipment for residue management. Promoting organic farming practices and crop rotation can improve soil health and reduce the need for harmful practices. Educating farmers about the environmental and health impacts of stubble burning is essential to encourage a shift toward eco-friendly methods. Protecting yourself from smog exposure. While reducing smog at its source is vital, individuals can take steps to protect themselves. Wearing masks, especially during high smog periods, helps filter out particulate matter. Installing air purifiers at home can improve indoor air quality and reduce exposure to pollutants. Limiting outdoor activities during peak smog hours is another effective measure. For those with pre-existing conditions, consulting a doctor and keeping medications handy is crucial. By taking proactive steps, we can minimize the harmful effects of smog on our health. Smog is not just an environmental issue, it's a public health crisis that demands immediate attention. From respiratory illnesses to environmental degradation, its impact is far-reaching. Let's act now to ensure that the air we breathe supports life rather than endangering it. If you found this information helpful and want to stay updated on more tips for healthy living, don't forget to hit that like button and subscribe too. We've got tons of useful content to help you take care of your body, so make sure you're part of our community. Stay healthy and see you in the next video.